Hi, my name is Malcolm McRae, and I'll be doing my project on coronary heart disease in the world for Dr. Manning in Medicinal Chemistry 4920. In this video, we will go over what the disease is, the statistics around the world, the effects on the world, well, essentially why it's important, and how to combat the symptoms or prevent the disease. Coronary heart disease is actually a cardiovascular disease. These are disorders of the heart and blood vessels. They include many diseases such as coronary heart disease, cerebrovascular disease, peripheral arterial disease, rheumatic heart disease, congenital heart disease, and deep vein thrombosis or pulmonary embolisms. As mentioned in the last slide, these are cardiovascular diseases. Cerebrovascular disease is actually a disease in which the brain is not getting blood from the blood vessels coming from the heart. Peripheral arterial disease is a disease of the blood vessels that can't supply the arms and the legs. Rheumatic heart disease is damage to the heart muscle and valves from rheumatic fever. Congenital heart disease is actually malformations of the heart at birth. And deep vein thrombosis or pulmonary embolisms are blood clots in the leg veins which dislodge and move to the heart or lungs. Cardiovascular diseases are some of the world's leading causes of death. A total of 17.3 million people died from a cardiovascular disease in 2008. 7.3 million of them were due to the most deadly of them all, coronary heart disease. An average of 380,000 Americans die from coronary heart disease every year. Coronary heart disease, also called coronary artery disease, is the most deadly of the cardiovascular diseases. This disease is caused by the hardening of the arteries, or atherosclerosis. This happens when there is a buildup of fatty deposits called plaque in the arteries, which can essentially decrease the amount of oxygen the heart is able to obtain by restricting the pathways to the heart. This process is called ischemia, which can cause symptoms like chest pain and pressure. This can weaken the heart. After the symptoms have been seen and ischemia has occurred, there is a possibility for the diseased part of the artery where the plaque is built up to break off some of the plaque. When this happens, the body will try and fix it as if it were a cut. This can cause further blockage of the artery, which can then cause myocardial infarction, which is a heart attack. What is so scary about this disease is that anyone can get it. It can be caused by bad diet, too many fats, triglycerides, and cholesterols. It can be caused by smoking, drinking, or many other factors, including heredity and obesity. People from around the age of 65 and older have the greatest risk of contracting this disease. Though deadly, there are still very good and successful treatments for this disease. The most common are aspirin, which helps prevent the formation of blood clots. Second are modifications to the diet of the individual, essentially cutting out too many highly fatty foods with higher amounts of triglycerides and cholesterol. On more extreme and aggressive plaque buildup, they may use angioplasty and a stent, in which they insert a balloon in the artery where the obstruction is and inflate it so that the blockage is held firm against the wall of the artery by the stent, as seen on the left. The more expansive surgery is that of a coronary artery bypass surgery, where they completely bypass the problem site using a graft from the patient's body. There are ways you can prevent this disease completely. A few of the ways are you can work out regularly, which help your heart, maintain a healthy and balanced diet, maintain a healthy weight. If you do smoke, make sure you quit smoking, and you can also manage your stress the best you can. In conclusion, coronary heart disease is very deadly, but with early detection, it is highly treatable. Just make sure you schedule regular visits with your local physician to stay on top of your health. and assess your risk for disease. Thank you for watching.